manufacturing access to COVID-19 and to announce the chair and convener of the meeting, His Excellency Musa Faki Mahamat, Chairperson of the African Union Commission. May I now call upon Musa Faki Mahamat to drop a remark. I'm now calling upon His Excellency Musa Faki Mahamat to make his welcome remarks.
Yeah. His Excellency was making the remarks, but he was muted. Can somebody please unmute His Excellency?
Excellence, Monsieur le Président de l'Union africaine.
See the Chair of the African Union, your heads of state in your various capacities. Permit me, first of all, to welcome you and to thank you very dearly for accepting to participate in this very important meeting on fighting COVID-19. The people in the world and in Africa and the issue of vaccination, which is the center point of this meeting. It is indeed very urgent, an urgency which is made even greater by the various variants in the world and especially in Africa. I would like to salute the setting up of mechanisms like COVAX, coordinated by the WHO, David, and CEPI. I would also like to congratulate partners, multilateral and bilateral partners. Ladies and gentlemen, the COVAX mechanism will be able to meet 20% of the continent's needs and
en Afrique subsaharienne, plus de 90%.
In sub-Saharan Africa, more than 90% of this is found in people of less than 60 years, and more than 80% of infections are asymptomatic. That means that the young people are reserves of the pandemic. Besides the 60% of vaccination, confinement is the only method to stop the virus. You know the devastating effects on economies which are essentially informal. Physical distancing is affected by our way of living on our continent. Education, online education is not very often available because of lack of technological development. So education will continue to be disturbed. This means that a number of cultural factors in Africa make it difficult to follow all the barrier measures. So on what pillar should our vaccine strategy rely on? Obviously, it should rely on the acceleration of Africa's participation in the clinical development of a vaccine. And the attention should be centered on multiplying efforts, continental and bilateral, to access vaccine. The elimination of obstacles to distribution and widespread use of vaccines in Africa should be another axis of a strategic commitment. The intensification of our commitments on the continent with our strategic partners for a new world health order, which will create a framework for innovation. I'd like on this note to insist on the African Agency for Medication, which we instituted. We ask all member states to sign and ratify this act. I have appointed the Minister Michel Sidibe as a special envoy to carry out advocacy for this. Another important aspect is the funding of public health that President Paul Kagame is the champion. I'd like to congratulate all the presidents and head of government, and also to thank the President Cyril Ramaphosa, who is championing the cause. I'd also like to thank the special representatives and our partners, especially the African Union, the World Bank, the FMI, and G20 for the efforts made to alleviate the death of African countries. Your Excellencies, ladies and gentlemen, the production of vaccine and access to vaccine is an absolute necessity for our continent. It is not possible, if we take into consideration the situation in Africa, to be able to overcome this if we do not insist on the implication of African institutions in the production, especially to fight African-specific pandemics, Ebola, Lassa fever, etc. It is also important to emphasize the rivalry in the production and availability of vaccines. Africa should be a priority, and this can only be possible with a substantial effort in Africa that we are encouraging. Thank you for your kind attention.
I thank His Excellency for his remarks. It is now my honor to call upon His Excellency Felix Chisekaiti, Chairperson of the African Union and President of the Democratic Republic of Congo, who will in turn invite the participating heads of state and government, as well as other speakers to make their remarks. Thank you.
Bonjour.
Good morning.
Le président s'excuse pour 10 minutes.
The President is craving your indulgence for 10 minutes. If you can be patient for 10 minutes.
Bonjour.
Good morning.
Allô?
Hello.
D'accord.
The President is not available for the next 10 minutes. Should we wait or should we move on with the agenda?
It's better. Protocol, you can give the floor to President Ramaphosa, please. Muchomba?
Yes, please. We will go ahead with His Excellency Cyril Ramaphosa, President of the Republic of South Africa, to make his remarks.
Chair of the African Union, His Excellency President Felix Chisekaiti, Chairperson of the African Union Commission, His Excellency Moussa Faki Mahamat, President of the Republic of Rwanda, His Excellency Paul Kagame, President of the Republic of Senegal, His Excellency Macky Sall, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, Director General of the World Trade Organization, Dr. Ngozi Okonjo-Iweala, Director of the CDC, Dr. John Nkengasong, distinguished participants, ladies and gentlemen. This virtual conference is taking place at a critical moment in the struggle of our continent and the global community to overcome the COVID-19 pandemic. While the global rate of transmission continues to climb, millions of people across the world are being vaccinated every day. Despite concerns around new waves of infection and the emergence of new variants, the production of effective vaccines has provided hope for recovery for many. But not all countries can share equally in the hope of having access to vaccines at the time they need them most. The global disparities in wealth and capability to develop, to produce, and have access to vaccines is hampering efforts by middle and lower income countries to make vaccines available to their populations. The challenge that many African countries face is that the supply of vaccines is currently too slow to meet our needs. Our immediate task, therefore, is to secure sufficient vaccine doses for African countries through the African Vaccine Acquisition Task Team, which has made valuable progress through its engagement with vaccine manufacturers. This effort is supported by other initiatives to manufacture vaccines on the continent where possible under license and in collaboration with current developers and manufacturers. The Aspen facility in South Africa, for example, will make some 220 million doses available following the African Vaccine Acquisition Task Team's agreement with Johnson & Johnson. But that is only the beginning. Throughout this pandemic, Africa has demonstrated that it has extensive and substantial capabilities, as well as resources and skills to address the challenges that are given rise by the pandemic. Africa's response has shown the depth of scientific expertise on the continent and has provided an opportunity for unprecedented scientific collaboration. Through initiatives like the Africa Medical Supplies Platform, the continent has pioneered new ways of ensuring access to vital personal protective equipment, as well as diagnostics and therapeutics. Through our own continental institutions, we have mobilized substantial resources to support the health response to this pandemic by the continent. Importantly, the leaders of the continent have demonstrated the political will to act decisively in the face of this grave threat to health and well-being of the people of our continent. Our task now is to harness all these capabilities and to draw on the experience of the past year to build a vibrant and innovative African medical supplies manufacturing capability that meets the health needs of the continent's people. This means that in the medium term, we need to expand existing capabilities into regional hubs that serve the continent as a whole. To do this, Africa needs to harness its own continental capabilities and identify opportunities for collaboration across several countries on the continent. We also need to forge sustainable partnerships with entities in both the developed world as well as the developing world. Partners in various countries could offer technological expertise, financing, and investment. Countries such as India and Brazil could provide guidance on how they developed their own generic pharmaceutical industries. Such collaboration should form the basis of a longer-term strategy to develop a medical supplies industry that can achieve continental scale, taking advantage of the large, growing, and increasingly integrated African market. The private sector will be essential to the success of this effort. In addition to domestic government spending and regional financial commitments, the public and private sector will need to invest in such initiatives. We will also need capacity building in the form of skills and knowledge transfer to ensure that we can sustain local manufacturing on the continent. In ensuring an effective response to the current pandemic, we must strengthen our ability to both respond to future health emergencies and to achieve health security for the people of our continent. The vision of a strong African medical supplies and vaccine manufacturing capability that responds effectively to the health needs of the African people is bold and also ambitious, but it is achievable. From the experience of the past year, I am confident that Africa is closer now than ever before to the fulfillment of this vision. I thank you.
We thank His Excellency for his remarks. I now call upon His Excellency Paul Kagame, President of the Republic of Rwanda, to make his remarks. Thank you.
Excellency, President Felix Chisekaiti, Chairperson of the African Union, Excellency President Cyril Ramaphosa, the African Union champion for COVID-19, Excellency President Macky Sall, Excellency Moussa Faki, Chairperson of the African Union, Dr. John Nkengasong, Director of Africa CDC, Madam Ngozi, Director General of WTO, distinguished ladies and gentlemen, WHO Director General Tedros. I want to begin by thanking the African Union Commission led by Chairperson Moussa and Africa CDC for convening this timely conference. Vaccine equity cannot be guaranteed by goodwill alone, as we have seen many examples to convince all of us. Africa needs to expand production capacity for vaccines and other essential medical products. I can't agree more with President Cyril Ramaphosa. In line with our agenda of increasing domestic health financing, it is important for Africa to forge strategic public-private partnerships for vaccine manufacturing on our continent. Let me add here, Excellencies, that in the past few weeks and maybe months, I had the opportunity to initiate contacts with different manufacturers of vaccines, specifically focusing on the messenger RNA technique used, say, by Moderna and Pfizer. And we have been involved in the discussions, and I have briefed a few colleagues on our continent, but we want to take this forward by discussing it with others, where there is a company that is capable of this technique, just as Moderna and Pfizer have been doing, that is ready and willing, and we have been having these discussions. I will brief those responsible very soon. Sorry that I had not done that before we had this discussion. But the whole idea is now how we can also have this type of capability on our continent, which really complements other ways like the adenovirus method, vaccines used by Johnson & Johnson, AstraZeneca, and also South Africa. In Aspen, they have that capability, but I think the future also is about the messenger RNA, and I think in the audience there are people even better informed than myself, but I think complementarity is better achieved and if we focus on that. And therefore, for Africa, move from being really very sorry for ourselves, which is the case today, and I think no one, maybe single person, takes the blame for that, but we have to overcome that and move from what we know has not worked for us, for Africa, well, to something we can do and we are able to do, given a few examples, again, President Ramaphosa mentioned, by partnering with these industries. So, President, I say the African Continental Free Trade Area makes these investments even more attractive. The African Medicines Agency Treaty is also a critical part of the institutional framework, and I urge African member states to ratify this, as many as we can have ratify as soon as possible. I also commend Chairperson Musa for naming a special envoy for the African Medicines Agency, Dr. Michel Sidibe. Vaccine production goes hand in hand with increased investments in domestic health systems, as well as building an efficient and autonomous African CDC, which I think is the way we are headed. Rwanda is ready to play a role in this effort, together with other member states and partners. And on this note, I thank you very much for your kind attention.
We thank His Excellency for his remarks. It is now my honor to call upon His Excellency Felix Chisekaiti, Chairperson of the African Union and President of the Democratic Republic of Congo, to make his remarks.
Bien. Merci, Monsieur le Président.
Thank you, Mr. President. Mr. Chair.
Est-ce qu'on m'entend? J'ai l'impression que le
Can you
Président
hear me?
a un problème
I have
de connexion.
the feeling that
Je vous entends, Monsieur le
the
Président.
chair has a connection problem. Oh, no, I can hear you.
Très
Je
bien.
vous suis.
Bien. Avant toute chose, permettez-moi de vous présenter
First of all,
nous sommes en pleine préparation
let me
de la
apologize.
publication du
We
gouvernement qui
are
interviendra dans les
trying to publish the
donc j'étais
new government, which will be made public very soon. So I have been very busy. Sorry for the inconvenience.
les chefs d'État du
Excellencies, ladies
gouvernement,
and
Excellence,
gentlemen, heads
Monsieur
of
le
government
Président de la
and
Commission de l'Union africaine,
the chair of the African Union Commission, Excellencies, ladies and gentlemen, ministers, distinguished guests, ladies and gentlemen.
avant toute chose,
From the outset, I'd like to welcome you to this virtual conference and to thank you for your participation in spite of your busy schedule. I'd like to also avail myself of this opportunity to pay tribute to CDC Africa, which, as is a custom, has been playing a leading role in the preparation and holding of this conference. Our continent is paying the heavy price of transmitted and non-transmissible diseases in the context of a poor health system, which is not very resilient, with a lot of consequences on health and the economic security of the continent. Most of the clinical trials in Africa, in the world, take place in Africa. And infectious diseases to a loss in productivity. This morbidity will continue to increase due to the increase in non-transmissible diseases, in emerging and re-emerging diseases and other diseases such as malaria, AIDS, tuberculosis, Ebola, and the COVID-19 pandemic, which negatively impact the quality of life of our population. Due to several multidimensional threats linked to diseases, Africa needs a new public health order in order to safeguard health and economic security of the continent, and is trying to meet the aspirations of the Agenda 2063, which provides for an Africa where the population is in good health, an Africa where women, men, youth, boys and girls will be able to be fully operational. At the African Union, and thanks to CDC Africa, we think that the new public health order will require a collaboration, operation, and coordination at a continental level. The new public health order will be made up of first of the national and international continental institutions.
The constitutional and national institutions that need to be strengthened so that they can offer advice at their levels and work on issues that require collaboration, harmonization, and standardization. To this effect, I would like to remind us of the resolution that was adopted at the Assembly of Heads of State and Government in February this year about the principle of strengthening and empowering African centers for control and prevention of diseases by giving the power and the necessary authority to their leaders. In addition to that, I would like to make an urgent plea that we set up and we strengthen the national public health institutions in each member state. And secondly, I would like to make an appeal that that public health should have a strong leadership that does not protect only health, but also socioeconomic progress and well-being. And then thirdly, an approach that is based on collaboration and solidarity and on strong partnerships. And collaboration between African member states was the driving force in building the capacity to mitigate the impact of the pandemic. And our partnership with stakeholders on the continent, such as the African Development Bank and the Export-Import Bank, also within the special team for the buying vaccines, AVEN, and foundations such as the Bill and Melinda Gates Foundation for the distribution of vaccines was only an example of how partnerships can actually facilitate a quicker response. However, in order to be fully effective, we need to ensure that these partnerships are in keeping with the continental priorities, such as defined in Agenda 2063. And then fourthly, the capacity to manufacture therapeutic products, vaccines, and diagnostic products. Only the capacity to provide these products ourselves can truly guarantee access to the necessary input. Several examples demonstrate that Africa, if Africa is to strengthen her capacity, but it can do that, but that will need concerted effort. There is therefore need for the continent to invest in the local manufacturing of therapeutic products, vaccines, and diagnostic materials.
More than
90% of the vaccines that we use currently are imported, and this was the choice that was identified, and this is the subject of this meeting, because our continent, like the rest of the world, has suffered heavy losses because of the COVID-19 pandemic. Indeed, in 2020, the pandemic had already represented over 80 million and 105 million deaths, representing 2.7% death rate in the 55 African countries that they represent 4% of deaths at the international level. The analysis of these tendencies these last 4 weeks from the epidemiological point of view shows that there has been an increase of 4% in new cases on the continent to date. More than 41 for detecting, for testing COVID have been undertaken with a general rate of 10.5%. Positivity rate, and several countries have reported death rate of above the 2.2 world average, and more than 36 countries have actually notified that there have been variants of the disease. It's better to prevent than to cure, as was so wisely said. Now, as concerns COVID-19, vaccination is one of the most effective and sure ways of preventing the fabrication and manufacturing of vaccines on the continent is essential to safeguard our economies, but also the health of our people. The achievement of the objectives in this conference will mean that we have leadership and political commitment and solid partnerships, bilateral, multilateral, and with the private sector. And this is the opportunity to acknowledge the presence of the political leaders of our continent, banks and major international organizations, but also the presence of researchers and African scientists. Indeed, we have many of them, and quality people who are there to build this new order of public health, and especially the manufacturing of pharmaceutical products. Amongst the amongst the lessons we have learned from COVID-19, we can talk about the urgent need to invest in the building of our own capacities for manufacturing vaccines in order to prevent the consequences of national vaccination nationalism in the area of a provision of vaccines. It is for that reason that I am very pleased that we're holding this virtual meeting, whose theme is specifically how we can expand the capacity for vaccine production on our continent. Even though we are working on all the aspects of the new order of public health, COVID-19 has not changed. Africans are affected in the same way as people in other parts of the world, but contrary to other parts of the world, Africa can only cover 20% of its population with the pro-vax mechanism that we would like to thank. We depend excessively on the vaccines that are manufactured outside the continent, and that means that there is distrust from the population. Now, let us not forget what we have said, that the African Union at the service of the African people, and especially we must have the resources so that we can actually cover 60% of the people, the level that we have fixed for ourselves, taking into account the impact of COVID-19 on their lives and the means of subsistence of the people, and also the means of creating it. It is time to honor the current commitments that we have and the lessons that we have learned from the pandemic, and to translate all of this into concrete action so that we can have a new order of public health for Africa, and especially the local manufacturing of vaccines, of diagnostic and the therapeutic products, which would contribute to health, would reduce the cost of provision, and would accelerate the reaction to any local threats, and the prioritization of the setting up and financing in a sustainable way public health institutions, and a process for greater collaboration within the framework of a network with the CDC at the center and other regional institutions. So that would need investing in setting up these institutions, the manufacturing capacity for the correct inputs, as well as the training of the necessary researchers for the manufacturing and support to laboratories. In order to do this, I would like to make I'm going to launch the initiative of partnership for the manufacturing of vaccines in Africa, which will be defined as follows. The initiative will have at least 5 production sites where vaccines will be manufactured, so that you can have a health security on the continent, the mobilization of resources with bilateral, multilateral, and private sector partners, and the transfer of technology to our continent, and finally the strengthening of research institutions at the regional level. We think that at the end of these 2 days of meeting, we shall be in a position to define the framework for the manufacturing of vaccines on the continent, including the fact of having the capacity of Africa's manufacturing capacity. We shall have recommendations for our partners for the implementation of that framework for the manufacturing industry, African industry. Now, as I conclude, I have no doubt whatsoever that these results will be achieved, considering the high level of the participants in this meeting that brings together men and women, politicians, workers of the African Union, leaders of multilateral and bilateral institutions, heads of industries and other representatives of the private sector, foundations, producers of pharmaceutical and non-pharmaceutical products, representatives of the civil society, and from academia. So I hope that your ideas will bring forth the light that will shine on the road forward for the effective implementation of the African capacity to produce vaccines. I would like to wish you success. Thank you very much.
Thank you, Your Excellency, for the remarks. I now call upon the Honourable Minister of Health of the Republic of Senegal, who will speak on behalf of His Excellency, President Macky Sall. The Honourable Minister, please. For the sake of time, I will now invite His Excellency, His Excellency Wamkele Mene, Secretary General of the African Continental Free Trade Area, to make his statement.
Thank you very much, Program Director, President Chisekaiti, Chairperson of the Assembly, His Excellency Musa Faki Mohammed, the Chairperson of the Commission, President Paul Kagame, President Cyril Ramaphosa, and all other heads of states that are in attendance here today. This conversation is happening at a very, very critical time when countries around the world are engaged very intensively in vaccine nationalism. We know that from the experience of the pandemic, many countries around the world have imposed export restrictions, and these export restrictions, particularly on pharmaceutical products, have a very, very negative effect on Africa. These restrictions cause distortions in global markets of pharmaceutical products, and they cause prices to increase, thereby making public health inaccessible to millions and millions of Africans. Through the African Continental Free Trade Area, we now have an opportunity to confront head-on this challenge of public health in Africa and to ensure that we lay the basis for Africa's accelerated manufacturing capacity. In the year 2019, Africa imported over $15 billion worth of pharmaceutical products. In a market of 1.2 billion people, a market of a combined GDP of $3.4 United States trillion, we as Africans, through the African Continental Free Trade Area, have a very unique opportunity to place trade and health at the nexus of Africa's industrialization. In the wisdom of the Assembly of Heads of States, they decided that the AFCFTA must be Africa's vehicle for industrialization. More importantly, we now have an opportunity when we start the negotiations of the intellectual property rights in a few months. We have an opportunity to craft an intellectual property rights regime that will achieve two things. First, it will ensure that there is a legal framework that will be flexible enough to enable access to public health for millions and millions of Africans. Second, our intellectual property rights regime must be at the service of Africa's industrial development objectives. We have learned our lessons from COVID-19, and we have also learned from our experiences in the TRIPS amendments that were made a few years ago, whose objective was to make sure that there is access to public health. Unfortunately, the TRIPS amendment was not as flexible as many of us would have liked. But as I say, we now have an opportunity as Africans to craft an intellectual property rights regime that will service Africa's public health imperatives and that will service Africa's industrial development imperatives. It is inexcusable that today vaccine nationalism is causing the anxiety amongst Africans who fear that they may not have the vaccine soon enough, or that it will take years before our populations are vaccinated. I am committed, working with ministers of trade and ministers of health and the African Centers for Disease Control and Prevention, to make sure that as we negotiate the intellectual property rights protocol of the AFCFTA, that at the center, integral to this protocol, will be Africa's public health and Africa's industrialization objectives. I want to thank you very much for inviting me to share my thoughts on this. Thank you, Chairperson.
Thank you, His Excellency, for the remarks. I now call upon His Excellency Dr. Ibrahim Mayaki.
Thank you, Program Director, Excellency, Chairperson of the African Union, Excellencies, Head of States, Excellency, Chairperson of the African Union Commission, Dr. John Kengasong, Director of CDC, distinguished guests. Access to essential medicines and vaccines is a national and continental security issue, and local manufacturing of essential medicines and vaccines is an integral part of Africa's developmental goals. The African Union Pharmaceutical Manufacturing Plan, PMPA, which is the framework for the continent to develop an implementation plan that will guarantee the supply of efficacious medicines to a market of 1 billion people. This framework is 14 years old. The objective of a PMPA is to facilitate improved access to affordable essential medicine and catalyze local production in Africa through increased political commitments and workable solutions. For the workable solutions to become a reality, there must be a commitment to support all the auxiliary services in the pharma ecosystem. AUDA-NEPAD's approach to local pharmaceuticals production and African-wide vaccine manufacturing leverages on our core mandate to coordinate and execute priority regional and continental projects. We leverage the research that has been done over the years to regionally cite and indicate what companies are more poised to commence local production of specific medical products or vaccines. Secondly, we leverage on the groundwork done with good work done with regional economic communities in ensuring that the right companies in the right region are enabled to manufacture, access, and utilize regional platform for procurement and supply chain management, and receive relevant training on-site and online. Thirdly, we leverage on existing initiatives like the African Medicines Regulatory Harmonization Initiative, which is a clear foundation for the African Medicine Agency, and we convene annually the Africa Pharma Platform, as well as the 100,000 SMMEs and our homegrown solutions business as accelerator. Lastly, leveraging on the support from development partners, AUDA-NEPAD through the Africa Pharma Platform, the Vaccine Manufacturing Initiative, and the AMRH initiative will, over the next 3 years, have these critical objectives. One, establish and operationalize Africa Pharma Partners Platform Secretariat in order to support an in-depth assessment and gap analysis of 100 pharma companies and coordinate the implementation. Two, support the operationalization of a fund for African pharmaceutical development, and in conjunction with strategic partners, set up a fund dedicated to growing local pharmaceutical production. 3, advocate for the ratification of a treaty for the establishment of the Africa Medicine Agency, which is the most urgent thing that Africa needs to do today. And 4, support further engagements on production of essential vaccines in Africa through the coalition of African research and innovation, CARI. These initiatives can strengthen the continent's ability to produce high-quality, affordable pharmaceuticals across all essential medicines, attract increased investment into local production in Africa, and improve the fragmented regulatory systems, and evidently contribute to the aspiration of the AFCFTA. The capability to produce vaccines requires coverage of a broad range of disciplines, a fully integrated approach, pooling finances, skills development, policy coherence, regulation, infrastructure, technology, to mention a few. No single entity can achieve the ambition of a new public health order for health and economic security. Synergy is the name of the game. I thank you.
We thank His Excellency for his statement. I now call upon the Minister of Health of Senegal to make his remarks. Senegal. It seems Senegal, we have a maybe connection problem. May I now call upon the Director General, WHO, to make his remarks.
Sir, can you hear me? Yeah.
Yes, indeed.
Your Excellency, President Felix Chisekaiti, Your Excellency, President Cyril Ramaphosa, Your Excellency, President Paul Kagame, Your Excellency, President Musa Faki Mohammed, Excellencies and colleagues, Dr. Ngozi, Dr. Vera Songwe, Dr. Mene, Dr. John Kengasong, Dr. Ibrahim Mayaki, dear colleagues and friends. Good afternoon, and thank you so much for the opportunity to share a few reflections with you today. The development, approval, and rollout of safe and effective vaccines against COVID-19 is giving us all hope of bringing the pandemic under control. Around the world, 194 countries and economies have now started vaccination, and 26 have not. COVAX has now delivered more than 38 million doses of vaccine to 105 countries and economies in the past 6 weeks. We're encouraged that almost all countries who want to start vaccinating have now started. However, I emphasize the word start. Most countries, including most African countries, do not have anywhere near enough vaccines to cover all health workers or all at-risk groups, never mind the rest of their populations. There remains a shocking imbalance in the global distribution of vaccines, as I have said it many times. More than 700 million vaccine doses have been administered globally, but over 87% have gone to high-income or upper-middle-income countries, while low-income countries have received just 0.2%. The pandemic has shown that global manufacturing capacity and supply chains are not sufficient to deliver vaccines and other essential health products quickly and equitably to where they are needed most. That's why building up vaccine manufacturing capacity in Africa is so important. And I appreciate the specific interventions or proposals that President Kagame and President Ramaphosa have made earlier. Investing in sustainable and secure domestic manufacturing capacity and national regulatory authorities is critical for providing essential immunization programs and for building strong, resilient health systems against the inevitable health emergencies of the future. WHO joins countries around the world that are calling on vaccine manufacturers to remove obstacles that are preventing access to critical health products. We continue to call on companies to share know-how, intellectual property, and data with other qualified vaccine manufacturers, including in low and middle-income countries. Making this work will require a coherent business plan based on coordination from regional economic communities, government support, and sustainable financing. To address this challenge, WHO and our partners have established a COVAX manufacturing task force to increase supply in the short term, but also to build a platform for sustainable vaccine manufacturing to support regional health security. Let me leave you with 3 specific ways in which the African Union and its member states can support local production and how WHO is ready to support you. First, we urge AU member states to explore every option for increasing production, including voluntary licenses, technology pools, the use of TRIPS flexibilities, and the waiver of certain intellectual property provisions. To facilitate technology transfer, WHO continues to call on funders and manufacturers to use the COVID-19 Technology Access Pool, or CTAP, as a voluntary mechanism for sharing intellectual property, knowledge, and data. WHO is ready to provide immediate technical support to assist countries in assessing the feasibility of local production and in accessing technology and know-how. Second, we urge AU member states to build strong regulatory capacity. WHO is ready to provide support for national regulatory authorities to become WHO-listed authorities as an important enabler for successful technology transfer and market entry of health products. The proposed African Medicines Agency will also play a vital role in regional regulatory capacity. And we're supporting the effort, and I renew my call for all AU member states to ratify the African Medicines Agency Treaty. I also congratulate my brother Michel Sidibe on his appointment as the new special envoy for the African Medicines Agency. And third, we encourage all AU member states to support the draft resolution on strengthening local production of medicines and other health technologies led by Ethiopia, Ghana, South Africa, Rwanda, Brazil, China, and others, and which will be considered at the World Health Assembly. My sisters and brothers, even before the pandemic, we knew that strengthening local production in Africa would be an essential part of our continent's journey towards universal health coverage. Now it's evident just how urgent this is. We must seize this moment. WHO is resolutely committed to working with the African Union, its member states, and the Africa CDC to support the development of domestic vaccine manufacturing capacity as part of our shared efforts to build a healthier, safer, fairer future for Africa. And we're working with my sister Ngozi and the 2 organizations, both WTO and WHO. We will support you in any way possible. And on Friday, she's hosting a meeting with manufacturers, and I will join her in that meeting. I know she will tell you more. And we will push in any way possible to make the local production a reality. Thank you so much, and thank you for this opportunity.
Thank you, Dr. Tedros, for your remarks. I now call upon